HCC is a cancer on the rise. It's risen significantly in incidence rates over the last several years, and is one of the top rising causes of cancer death in the United States. So I wanted to give an idea of the progress that we've made over the last few years in the treatment of patients with advanced disease, and use that as a foundation for how we start to think about sequencing. Before we had only one treatment that was proven efficacious in this setting, and now we have a number of treatments, and so beginning to think about sequencing is sort of a good problem, right? We have all these options. What do we do with them? So we have sorafenib versus lenvatinib in the first line setting. Those were proven to be non-inferior, but lenvatinib did show encouraging signs of improved progression-free survival and response rates for patients with advanced disease. So that is an approved option now. We also discussed differences in sorafenib responses based on the etiology of the underlying liver disease. So, this is a unique patient population that has a number of different risk factors causing underlying liver disease, and how that impacts their responses to the various systemic treatments is important as a means of figuring out sequencing. We talked about second-line treatments. So we have regorafenib, nivolumab, pembrolizumab, cabozantinib, which have all proven to be efficacious in this setting of patients who getting second-line treatment after sorafenib failure.